Be willing to fail fast, learn from it and move on, move to the next thing.
Hello, and welcome to On Purpose. Today, I'm joined by Dr. Angela Shippy, who is the Senior Physician Executive at Amazon Web Services, or AWS. Welcome.
Thank you so much for having me. It's great to be here, Kristen.
So I know that all the people watching today are going to be so inspired by all you have accomplished, but what I wanted to start at is, what inspired you to actually be a physician, which was the beginning of this journey?
So I'll tell you, I decided that I wanted to be a physician when I was 9 years old. And part of it was because a teacher told me that I was really smart. And so 9-year-old me thought, well, if you're really smart, you should be a doctor. And if you're going to be a doctor, then you should be a neurosurgeon, because of course the brain is the most difficult and complex part of a person. And then over time, what I found is that my natural curiosity as an only child and the immense connection that I felt with people, that I not only wanted to be a physician who could help others, but I also wanted to be a physician who took care of lots of people in lots of different ways. So ultimately, I decided I wanted to be an internist.
So your desire to have impact in healthcare at scale brought you into technology. What do you think are the technologies that are going to have the biggest impact on healthcare over the next, say, 5 years?
The biggest change is going to be, we're going to get to that point, as I have my healthcare hat on and I think about the years of taking care of patients, to where we have the access that we need for patients. So no matter where they are, no matter what their question is, they're going to be able to get the answer they need. Sometimes they just need a little bit of help and a little bit of information. And sometimes they need a lot more information, like if they just had a new diagnosis. The ability to be able to have those tools right at their fingertips, right with their smartphone, being able to interact with a clinician, with information from a specialty society, with their health system where they're already established, being able to have those personalized interactions so that they can also be part of taking care of themselves outside of the four walls of a clinic or a hospital is going to be really important.
So one of the things I love about you is your infectious passion. You seem incredibly purpose-driven. So if you were to sort of define your own personal purpose, what would that be as you look back on your career?
Sure. I mean, one of the things that I've always loved about being part of a healthcare environment is the way we work in teams and the way we help each other and the way we really need everybody's expertise around the table or around the patient, if you will. When you're working together, sometimes it's not always easy when you're taking care of the patient. Sometimes it's not always easy when you're in an administrative role. So being able to work together, be completely transparent in what's happening, and really share the good and the bad times. I mean, that's what always has connected me to the work that I do. That's what really drives me. And what gives me a lot of joy is knowing that over the years, medical students, interns, residents that I've had, when they go on to do something else in another organization, they're taking those learnings with them. So again, it's another opportunity to scale. And I've really always enjoyed being able to see people thrive in what they do.
So you are a role model to so many healthcare professionals across the U.S. and undoubtedly across the globe. What was some of the best advice you received that sort of helped you achieve where you are today?
I had someone who was a great mentor to me who said, one, you need to be true to yourself, connect to your purpose, know that you need others on your team. Remember the good times. Remember the things that you've done well or your team has done well, because that'll help you get through. And also to always lead from a place of authenticity, like who you are, what your purpose is, what you believe in, and that's how you can inspire others to want to do the same.
Yeah, so as you think about your daughter and the next generation who's coming into healthcare, what advice would you give them?
Well, one of the things I would say is be willing to fail fast, learn from it and move on, move to the next thing. Sometimes things won't go your way, that's okay, but don't harp on it. Really remember to celebrate those moments that did work well. And the other thing is to be in a place of gratitude. I really enjoy the fact that I can help somebody else. I have a book of thank you notes that I've received over the years from colleagues, from patients, from mentees. And every once in a while I'll go back and look at that. And I just love seeing that the work really does make a difference, and it really propels me to continue on.
Well, you have been an incredible positive disruptor for healthcare, an inspiration to so many people, and I love your focus on gratitude. So thank you for joining me, Dr. Shippy, and thank you for joining us for this episode of On Purpose. I look forward to seeing you again next time.